Welcome back, everyone. Thanks for joining us again during our Alzheimer's video series. I am Elizabeth Miller, Functional Medicine Health Coach, and this is Dr. Erin Morland, owner and practitioner of Vallejo Health and Wellness Center here in Eden Prairie. Today, we are really excited to talk to you about atrophic Alzheimer's. So if you are anything like myself, when you think of atrophic, kind of the word that comes to mind is atrophy. And when you think atrophy, you think of degeneration or something lessening. So my first question for you would be, can you tell us a little bit more like how that might relate to this type of Alzheimer's?
Yeah, for sure. I think when people hear the word atrophy, I think most of us think of the person that got a cast on, maybe it was on their leg, got the cast, and then when they took the cast off 3 weeks later, their leg got a lot smaller. So that's the atrophy I think most people are thinking of. Really, it's a little different with the brain, because what we're looking at is the brain does shrink, obviously, when you deal with someone dealing with Alzheimer's and such, but it's more trophic factors are things that the brain needs, and A just means you don't have it, so atrophic factor is I don't have these things that my brain needs to work the way it's supposed to. And really the big ones that we see when we look at some of the atrophic factors would be not enough hormone, maybe not enough of the things that the hormones drive. So some of the hormones we would think of would be like estrogen, testosterone, progesterone, and then the things that they drive would be like brain-derived neurotrophic factor or neural growth factor. And then we also think of some of the things that would help the hormones to get created. So those are the big things that we see that are what we consider atrophic, is that not getting those things. So the brain's not working the way it's supposed to.
Okay, so this type of Alzheimer's is very related to hormones and hormone imbalance, it sounds like. Is there anything else that kind of really can contribute? Yeah,
and I think probably the first thing is to understand is there are certain things that we may not even think of as hormones, those being thyroid hormone. And so thyroid hormone plays a huge part because that's what drives energy. And so if you don't have that, you're not going to have energy to those cells. You may not think of insulin as a hormone, but insulin, and we talked about that in the last video, so insulin resistance is obviously going to cause problems with the brain. And then one that I think most of us don't really think of a hormone, because the name of it is a vitamin, vitamin D. When they first discovered vitamin D, it really, all the things that they saw it working with was it did act more like a vitamin. It was just like a cofactor. It was something that helped chemical reactions happen. But now we're seeing that vitamin D actually causes things to happen. So vitamin D, if they were to have discovered it now, and all the things that it does, they would definitely call it a hormone. So those are like three things that we don't even think of as hormones, but still are hormones. So definitely hormones, but then we look at other things like gut health. You may not think of that have much to do with hormones, or at least things to do with the brain, but we all know that a lot of us have heard recently the gut-brain axis, and so gut health is really important, or liver health is very important, because those things drive our ability to either make a hormone, or once we've used that hormone, to get rid of it, so it's not still floating around acting like a hormone in our body. And so those things are also really important when we look at someone dealing with atrophic factors.
Okay. And just with everything you've said with hormones, if we think of a hormone imbalance, or we think of issues with thyroid or even vitamin D deficiency, a lot of times that stuff that we associate more with women than with men. We just happen to see it more often. So do women run a higher risk of developing this type of Alzheimer's?
I think we want to make sure that we don't go down that path that, women are all out of balance, their hormones are always off, that's what's wrong with them all the time. That's definitely, when you look at women's health, hormones do play a part in it, but they do in men as well. But a lot of times you don't really see that. We don't have, per se, a cycle, and so you don't really see those patterns like you would with women. But you do see it in men as well, but you're exactly right that you will see this type of Alzheimer's affect women more because of the different hormones that they have, from hormones with pregnancy to hormones going through menopause,
Yeah.
and those are things that men don't deal with, and so you will see that women are more at risk than men when it comes to this type of Alzheimer's disease.
Okay. And with a lot of the factors that you mentioned with estrogen and progesterone, testosterone, vitamin D, all of these things are things that can be tested with blood labs, right?
Yeah.
So
Yeah, so it's good to have them tested.
Mhm.
Obviously, there are different types of tests. I think when most people go get a blood test, especially if they just go to their regular medical doctor, they're going to do it through a blood test. And what that blood test is going to look at is when our body produces a hormone, it doesn't just release it in the bloodstream and hope it gets to where it needs to, or let it bind to other things on the way there. It gets bound by what we call sex-binding globulins, or thyroid hormone gets bound by a thyroid-binding globulin. Think of it like the bus. It's got to be the thing that takes that hormone to its designated area and not letting it bind to other things on the way there. And so that's what a blood test would look at. But the problem is when it gets there, does it get unbound? And if it doesn't, it's great that you have the hormone, but you're not using it. And so that blood test is one part of the picture. And looking at other tests that can help to see, well, did it get unbound? When we look at, and I didn't even mention this, these hormones is some of the adrenal hormones like cortisol. A good way to test for that actually is in the saliva. And then a good way to test for your sex hormones is looking at urine. And so those hormones that would be in the urine will actually be the end product, the metabolite, where it's broken down. So you can see indirectly like how much did you actually use. So you could get a blood test to see how much you have, to make sure that the gland is working the way that it's supposed to, and then you can, that's producing the hormone, and then you can do a urine test to see, did my body actually use that? And so I think it's really important that you actually look at that whole picture, not just that one, because we've seen people many times come into our office say, hey, my hormones were in normal level, but then when we ran that urinalysis, we could see, well, you didn't actually use that hormone, and that's why you're having the symptoms that you're having.
Right, that's really interesting. I mean, I'm one of those people, right? Like I've gone in and gotten my blood tested, and everything at first glance appears normal, but I actually have signs and symptoms that tell me things aren't normal. So what are some symptoms what sorts of examples of symptoms or signs could people be looking for that would even maybe indicate, okay, I should either get a blood lab done or I need to do more digging into these other sorts of tests?
Yeah, and I think, well, let's start with women. When you look at women, what kind of symptoms they might have, I think it's good to look at years over the course of their life hormones been, because that can be a pretty good indication that if your hormones are bad in your 20s, 30s, 40s, they're probably not getting better as you age, unless you're doing something.
Yeah, I was going to say, especially unless there's been any sort of diet and lifestyle changes.
Yeah, unless they had some kind of intervention, they're probably not getting it better. And so some of the signs there would be people dealing with like fibroids, people dealing with endometriosis, people that
like
are
PCOS.
You look at just like really heavy bleeding, premenstrual cramps, those kind of things that unfortunately to many women, they've been told, well, that's just normal.
Right.
Like, it's just that's what all women deal with, and in the United States that probably is common, but it's not normal to see. And so you look at that as kind of a precursor to, okay, what are my hormones going to be like as I get older? A shift, especially you see it in women that are pregnant, they don't have these hormone issues, and then they get pregnant, have a baby, and then all of a sudden they have these hormone issues afterwards. That can be another sign. Definitely with women as they get older and go through menopause and they produce less estrogen. Estrogen is a hormone that really is protective for the brain, specifically the hippocampus. And if you remember in some of the other videos, the hippocampus is where we create our memories. So if we're not protecting that hippocampus, then what can happen is that woman's hippocampus is going to degenerate faster, and so the issue that they would see would be memory issues. So it definitely is, and that's where it can get a little confusing, is it's very similar to the other types of Alzheimer's, especially the inflammation and the blood sugar one, is that they're going to all have a memory issue. And that's why it is important that you do have to do testing to really see, well, what's driving it. So that's what you may see in women,
Mm-hmm.
in men. Some of the things you'd see again with hormone imbalances, because it's less visible in men, but some of the big
Yeah.
ones that you'll see is that a man, they need to have a certain level of testosterone to be protective for their brain. And so with men, you'll actually see that some of these men start producing too much estrogen. And it may actually not even be that they're producing the estrogen, it's being converted by an enzyme called aromatase. And so what's happening is those men start noticing that maybe lower energy, sex drives being affected, waking up in the middle of the night sweating. So night sweats is a big one, so they can have high levels of estrogen that's driving those. Night sweats, they may notice depression. They may notice that working out, maybe there's someone that exercises and they've always been pretty good about recovering. Now all of a sudden it's taking weeks to recover from a workout. Those are all signs that their testosterone levels are being impacted, and it is something to be concerned of because that will affect the brain later on in life as well.
Okay,
Yeah.
interesting.
Yeah.
And so, this being very, very much so a hormonal imbalance sort of thing, what might a protocol look like for someone who comes in with, and we've determined that it's the atrophic type of Alzheimer's?
Each person's different and unique, and so I know we've said that before, and I know people want to know what kind of things they can be doing. So there's definitely things that they can be doing, but we definitely want to look at their individual reasons why.
Very tailored.
Because functional medicine is not looking at, well, you got this symptom, if we just give you this, external hormone, then you'd be good to go, and not really solve the reason why they have it. It reminds me of my wife going to the doctor. This is many years ago now, but she was dealing with like major pain. She was driving home one day and major pain in very related to her cycle, and had to pull over even, couldn't even drive her car home.
Wow.
And so came home, she's lying on the couch just in like agony, and so talked to, hey, you gotta go to the doctor. Went to the doctor, and the doctor asked her how old she was, and I think at the time she was 36. She's like, well, you're just getting old, which 36 years old.
It's not old.
Yeah, so I don't know what your definition of old is, but that's not old. And so at 36 years old, she's got this major pain, and the doctor said it's just a normal part of aging for a woman. Yeah. And she told her to just go home and take Midol and you'll be good. And so we didn't accept that answer. Took her to another doctor, and they found out that she had fibroids to the point where it had ruptured. It caused a lot of damage to her ovary to the point where she actually had to have that ovary removed.
Yeah.
And maybe if we had discovered that years before, like what was driving that, we could have avoided that. But that being said, just treating a symptom does not solve an underlying problem, and so what we look at is figuring out what can we do to help with it. So I mentioned thyroid being one of the issues, trying to figure out what's driving, because most people that have a thyroid issue, it's autoimmunity, so it's really an immune problem. So trying to figure out what's driving the body to attack its own thyroid, which can be anywhere from food changes to toxins to viruses they might be dealing with. We look at trying to support the digestive system. We look at supporting the liver. These are all things that, again, help us to make the hormones and to clear out the hormones. So really important that we look at those kind of things. Some of these people may actually have an organ that is either, like my wife, removed, or they may have an organ that's so damaged that it's not going to produce what it needs to, and so they may need to have hormone replacement therapy.
Okay.
So HRT, kind of controversial, because we know that with women taking it, it can increase risk of heart disease or certain cancers. So it is really important that we understand that how we do that. And so there's different types of hormone replacement therapies, like synthetic versus what we call bioidentical. And so in our office, we can utilize things that are bioidentical, like herbs and spices and such, that there's literally foods out there, things in nature that mimic our hormones, and so we can use that. And then there are certain animal hormones that are used in people. So a great example of that is, if you're familiar with thyroid medication, the Synthroid. That's
Oh,
a
yeah.
synthetic version. A lot of people don't do well on it because it being synthetic, their body doesn't recognize it, or they don't convert it well, or the fillers in it they react to.
Yeah.
And so, yeah, that versus a hormone, thyroid hormone called Armor, which comes from a pig thyroid, and some people do really well on that. And so that's an example of that for some of the estrogen and progesterone stuff. You're looking at utilizing it from horses, which we're not big fans of because they're just, it's a much bigger animal.
Right, very different.
Yes, and so, but like I said, you can utilize that. So, so sometimes a person has to work with an endocrinologist that is willing to play around, try some of the different external hormones as well. But that's pretty much the big ways we'd approach someone that's dealing with atrophic problems causing Alzheimer's.
Yeah, good to know. Well, that's really the last question I had for you today. Is there anything else, any closing comments that you want to leave people with today?
Yeah, I think for sure the biggest one I want to leave is that as we go through these videos, I think you can almost feel like it's getting more and more complicated, and because it is. Yeah, I'm feeling that way, and so it is a complicated disease. It's not a simple disease. That's why there isn't one drug that just solves Alzheimer's disease. So because it's complicated, we understand that people are probably not going to be able to just do this all on their own.
Right.
Okay? But making these videos, we really want to make sure that we give people tools so that they can do. That there are things for sure that a person can do that would help them to either prevent it, to slow it down, or even reverse it. So it's really something that as we make more videos, we're going to be starting to get into more and more of the things that people can do, like the gut support. We talked about making a video on to help with leaky gut. We're going to talk about liver support. Those type of things will be really helpful in helping that person. Those are the things they can do on their own.
Okay, yeah.
And then we're here as a resource. We're here as if they need that help, which I would say most people will, that we come alongside them and help them do the things that can help them to deal with this devastating disease.
Yeah. So we will make sure to include our contact information readily available to you guys. If you have any questions, feel free to reach out, call our office, shoot us an email, get in touch with Dr. Aaron, and we'd be happy to talk to you guys. If you haven't already done so, absolutely find the link to sign up. Make sure that you are receiving all of these videos so that you can be better informed about all of the different types of Alzheimer's and the things that you can do, whether on your own or with us, to help prevent or potentially reverse Alzheimer's.
Absolutely.
So, thank you guys again for tuning in.
Thanks, Beth.